Next tumor will be meningioma. So meningioma tumor cell of origin will be the meningothelial cells which line the meninges, and here this is the most common primary benign tumor seen in the adult. Okay, primary benign tumor in child was pilocytic astrocytoma, while in an adult it is going to be meningioma. While if they ask the primary malignant tumor in a child, it is going to be medulloblastoma, while in an adult it will be glioblastoma. Okay, so like ependymoma, this is also going to be associated with neurofibromatosis type 2. And here again we can have EMA positivity, which is epithelial membrane antigen, vimentin and progesterone receptor. So on IHC, if you see, these markers will come positive. Since PR comes positive, you can also expect it to grow during pregnancy. So progesterone receptor, PR is progesterone receptor. So meningiomas usually increase in size during pregnancy. Okay. And the classical image of a meningioma will be a whorls of these meningothelial cells. So if you appreciate here, it is appearing as if it is like this, right? So cells are all arranged in a whorl kind of pattern. So these whorls of meningothelial cells are seen in meningioma. And here also it is an example of where Schwannoma bodies can be present. So Schwannoma bodies are laminated calcifications, right? So here again you can see that this picture is full of this Schwannoma bodies only. So example of Schwannoma body is seen in meningioma also. Next we'll see Schwannoma. So Schwannoma will arise from the Schwann cells, and most commonly it is going to affect the 8th cranial nerve, especially the inferior vestibular branch. So inferior vestibular branch of 8th cranial nerve is usually affected in Schwannomas, and here the most common site will be the cerebellopontine angle. And here again, like ependymoma and meningioma, it is associated with neurofibromatosis type 2. So my classical microscopic image, it is a spotter kind of a diagnosis. So here you have both hypercellular and hypocellular areas. So the hypercellular areas, like here, this area is hypercellular. Here you have hypercellular. And if you see in these hypercellular areas, the nucleus is all arranged parallel to each other. So this is an example of true palisading. So where did we see pseudo palisading? It was because of necrosis. We saw the cells being having a pseudo palisading appearance. That was in glioblastoma. But here the nucleus as such of this tumor cells are arranged parallel to each other, and this is called as true palisading. So these hypercellular areas wherein we see this true palisading is called as Antony A areas, while this area in between is going to be hypocellular. So hypocellular areas are called as Antony B areas. Okay, and when these hypercellular and hypocellular areas are there with this palisading, it is together called as a Verroque body. So this thing is called as a Verroque body. Then last CNS tumor will be a CNS lymphoma. So lymphomas are usually seen in CNS during immunocompromised state. So even in HIV, if you had seen, it was one of the AIDS defining tumors. So AIDS defining tumors were NHL, the primary CNS lymphomas, then other than that, Kaposi sarcoma and also cervical cancers, right? So in the CNS, they can cause primary CNS lymphoma, which is going to be of the diffuse large B cell lymphoma morphology, and which is going to be associated with Epstein-Barr virus. So the last heading under CNS chapter will be this Ortega cells. So it was also asked one time in MCQ. So what are these Ortega cells? These are again modified macrophages of the brain only. So modified macrophages, these are microglial cells, right? So these microglial cells, when they eat up the myelin, the lipophages, so they are called as lipophages also. So myelin is composed of lipid, right? So when they eat up that, it is going to be called as lipophages, Ortega cells or jitter cells or compound granular corpuscles. All of these names are given to the modified macrophages in the brain only. Okay. So till now we had discussed about the various infectious causes, meningitis and encephalitis along with their inclusions. Then we saw about the various neurodegenerative and demyelinating diseases, in which neurodegenerative disorders is very important, especially Prions disease and the inclusions. Then after that, we saw about the various tumors. So tumors can be given as image-based questions, and if they are asked it as image-based questions, it's quite easy also, because all of this have a classical spotter kind of a morphology. Okay.